Football is a sport loved, watched, and played by many in the United States and around the world. But in recent history, the negative effects have become prevalent to those who have and continue to play the game of football. During the fall season, most college students are ready for football season to watch their school play. Even on Sunday, most look forward to watching their favorite professional football team and players play. Watching these games are entertaining for viewers, but for the player, it comes with a cost. A lot of young boys, when asked what they want to be when they grow up, rather say doctors, lawyers, or professional football player. Football is a part of a lifestyle to some people. I have played football since I was in elementary school until I graduated high school. First, I would like to describe the causes and types of injuries that can be sustained playing football. Next, I would like to describe the short-term and long-term effects of these injuries, followed by discussing a brain disorder called CTE. Now I will discuss the causes of football injuries. While all sports have a risk factor associated with them, football has a higher risk factor than most other sports caused by several factors. The main cause of football-related injuries is due to the dangerous combination of full contact and high-speed running. According to Dr. Robert Franks, who is a physician who specializes in sports medicine, over 400,000 patients across the United States were treated for football-related injuries in emergency room in 1 year alone. The main type of injury associated with football players are concussions, an injury common in contact sports such as football. According to the CDC, a concussion is defined as a traumatic brain injury caused by a bump, blow, or jolt to the head, or by a hit to the body that causes the head and brain to move rapidly back and forth. Concussions can result in CTE, a brain disorder caused by repeated head injuries. The injuries that can be sustained playing football are serious. Like all injuries, concussions can have effects on a person impacted by it. The injuries sustained by playing football can have short-term effects as well as long-term effects. The short-term symptoms of a concussion may appear immediately once the injury is sustained. Symptoms of a concussion can be physical as well as emotional. According to the Mayo Clinic, some of the short-term physical symptoms are headaches, ringing in the ears, fatigue, and dizziness or seeing stars. The short-term emotional symptoms may include irritability and personality changes, depression, and struggle to concentrate and remember. The long-term symptoms of concussion may take until a couple of hours or days after the injury is sustained to be noticed. Long-term effects of concussion include memory loss, trouble verbally communicating, as well as trouble reasoning. Personality changes is also a long-term effect of concussions. The effects of a concussion as a result of playing football is serious. Concussions are a serious brain injury which can be linked to CTE. Football has now been associated with causing a brain disorder known as CTE. As mentioned before, CTE is a long-term effect of head injuries as a result of playing sports such as football. The National Library of Medicine says CTE can cause progressive decline with memory and cognition, as well as depression, suicidal behavior, poor impulse control, aggressiveness, and eventually lead to dementia. In the study, it was found that 99% of former football players studied have CTE. CTE has caused professional football players to commit suicide. CTE is a very common disorder among football players and a serious health issue. With all the information I have presented, allow me to summarize the effects of playing football. I have shown that the causes of injuries in football are based on how the game is played. I also have explained the short-term and long-term effects of injuries such as concussions and how they can impact football players. I have also discussed the severity of CTE, which is common among many former football players. When you are watching your favorite team or player play football, think about how they are sacrificing their health every time they line up to play. I encourage you all to check in on those who you know play or have played football and see how they are doing mentally.